So let's talk about pregnancy and postpartum post-thyroidectomy. My name is Dr. Rebecca Warren. I'm a DC functional practitioner. I have worked with women for all types of health goals, and I specifically work for both men and women healing post-thyroidectomy. Now, not only do I practice, I coach people, and I have this amazing community of people that come together and get healthy together, but I'm living without a thyroid. So it's been this year, at the end of the year, it'll be 20 years that I had my thyroidectomy. So I have a very unique perspective, and that's what people love about me, is that yes, I might know the studies, I might know protocols, I work with people all over the world, but I'm also living it. I know what it's like to try to heal and thrive post-thyroidectomy and the nuances that come with that are not going to be showing up in the studies that most doctors write off. I'm living it. I understand that process. And so I want to share what getting pregnant and postpartum look like for me so that you guys can have hope and also just be aware of what makes things different through that journey post-thyroidectomy. Because in the end, I always say suffering post-thyroidectomy is never okay. It's just never okay. And so many people suffer due to not having their thyroid because of incomplete labs, not looking at the labs correctly, not getting on the right thyroid meds, not getting on the right dosage. It can be such a mess, especially when you don't have the right guidance. And that's why I do what I do. But I also talk about how life is different. You are not the same as someone with a thyroid, plain and simple. I see it myself. And when I talk to people about this in my consults or within my community membership, it's just there's a relief of oh my gosh, you understand. It's not it takes more work to feel well. It takes more work to be balanced, but you can get there. And I think one of the biggest things that concerns so many women is, what is my fertility going to look like? My pregnancy going to look like? My postpartum going to look like? And I will tell you this, just to give you guys some hope. The best seasons of my life were being pregnant. I've had 3 home births, 3 just incredible transformative births. My pregnancy, I will say the first 2 were very different than my third. My third, I was a little bit older, so it felt different just because of that, not because of my thyroid. But I felt fantastic during pregnancy, and you can too. But there's things you have to know and you have to understand. One of the biggest things I did before I ever got pregnant is I started to heal post-thyroidectomy. I started to educate myself and understand my menstrual cycles by the fertility awareness. And it's not like natural. It's not, natural family planning. No, fertility awareness is understanding day 1 bleed to the next day 1 bleed. My Bible on this, I give this to, I recommend this to almost every single cycling woman I work with, is taking charge of your fertility. Game changer. I thank the Lord, my OBGYN teacher in school. It's really funny. He was having a raffle, and you had to answer a question, and I was raising my hand because I was this book sounds interesting. He was raffling this book, and he gave it to a male student who didn't really seem like he cared. So I went afterwards and I went to his office and I was like, hey, I was really interested in this book that you raffled off, and it just seemed really interesting. And he just gave me a copy, and thank the Lord, it changed my life. Because when I, even before I had my thyroid removed and afterwards, it got a lot worse when my doctors were mismanaging my hormones. I had horrible cycles. I did not know anything about my menstrual cycle. It was very painful. I specifically remember taking 8 plus Midol the first day of my cycle was absolutely normal. I had PMS, and then things got weird when I lost my thyroid, because then it became irregular. It wouldn't come sometimes. Now I know I wasn't really ovulating. My hormones were a mess. But it was that book that taught me to understand my menstrual cycle as a vital sign. What does that mean? It means if it's a vital sign, if you go to the doctor and your doctor's getting getting your vital signs, it means, your blood pressure, your heart rate, your temperature, you're getting all these vitals because they're important. And if anything is off with it, then we need to dig deeper. And we know that a woman's cycle from day 1 bleed to the next day one bleed. And I'm not just talking about like when your period comes. It's like what goes on during that cycle. Do you feel good? Do you feel tired? Do you have loose stools? Do you get constipated? Do you feel more anxious? Do you feel more depressed? Do you feel more out of control? Like, do you have restless sleep? Day one bleed to day one bleed is filled with information. And taking charge of your fertility was a big catalyst for me to say, wait a minute, I need to understand my cycle. And I will say I had to do a lot of work. So I did a lot of work on optimizing my thyroid hormones. I had to essentially talk to my doctor about what to get and make him order it and then discuss with him and then actually optimize my thyroid meds, have him change me into natural desiccated back then, and optimize that. And I did all of that not because of fertility, but because, holy crap, I felt awful. And when I work with women that have some infertility, that have been trying for years or have had miscarriages, I always tell them, I think the biggest disfavor we do for women is we act like our sex hormones are baby-making hormones, and that's it. Oh, like you never really hear about progesterone or estrogen or prolactin. Like you don't hear about these hormones until you're trying to try to get pregnant. And only really essentially if you're having problems. But I tell women over and over again, like, no, these sex hormones affect you as a human being. Your ability to fight heart disease, your ability to fight cancer, your ability to be mentally well and emotionally stable, to have strong bones, to make you feel like you. These sex hormones are so much more than just your ability to get pregnant, but infertility and those types of things can be affected by that. I also want to give this disclaimer because I've worked with plenty of couples that have struggled with miscarriages and infertility. It is not all the women's fault. What am I saying? It's not all the women's issue, okay? It's not. We know a third can be related to the woman's health, a third can be related to the male's health only. So there's a possibility it's totally his health. Well, we got his sperm tested. Oh no, we're talking about overall health, DNA damage, mitochondrial health. Like it could be just completely the male partner, and the remaining could be a combination of both. And I think that's really important to talk about because I think so many women carry the weight of that when it can be fully 100% your partner's. And that's why I love working with my husband, because I'm like, I look at the woman, I'm like, listen, he needs to get it together. He needs to look at his health. He needs to look at what's dysfunctional and dysregulated there. So I want to go ahead and clarify that because this is not all a woman's issue, right? It is a woman's issue in the sense of truly there's so many women that have sex hormone imbalances and they feel it. And when it is affecting fertility for women, what I tell women, this is how I started this, what I tell them is, my number one goal is to get you well, you mentally, physically, emotionally well when it comes to your hormones. And a side effect of that is if this is the underlying cause is fertility, it's better menstrual cycles, and even for women postmenopause and perimenopause, it makes that so much better. So the goal is before I ever got pregnant, I knew my hormones, I knew my levels, I knew how high I had to get it. This is the biggest issue that I see is that once you get into medical range, medical doctors are like, okay, good, you're good to go. When it's not, no, because there's medical range, then there's functional range, which is a lot more narrow. And then there's where you feel best within those ranges. And I knew before I got pregnant that my whole life was like a 180 when I was on the upper end for both T4 and T3. And it was just life-changing. So before I got pregnant, I knew my numbers and I normalized my cycles. I will say one of the first things that really helped normalize like the pain of my cycles was chiropractic care. A DC changed my life, and that's literally why I'm here today. Why I went into my doctor's office and fired them and found someone that would listen to me. It was a DC that poured into me and taught me the true principles of health and healing, but it was a DC that really helped my painful cycles. Now, when the cycles went cuckoo because of thyroid hormones, then I had to really learn about my labs, my meds, and how to advocate for myself. So the biggest thing I think that can change everything for you is understanding your optimal levels and not just within medical ranges. So I knew my optimal levels. I was tracking my menstrual cycle, all the fertility signs that I needed to track. I knew I was ovulating. And I will say this, back then I used the Lady Comp, and it tracked my basal body temperature, and I also chart tracked. So I did that for years to truly understand my cycle. Now, and it's just so you know, I knew I was pregnant every single time, like within days. I looked at my husband, I'm like, oh, there's no oopsies. I just was so in tune with my cycle, because if I didn't care enough about it, like no one else was going to. So I knew that. I knew my menstrual cycle, I knew my hormones, I knew the best meds for me. But let's talk about what happens when you do get pregnant, like what happened for me during my pregnancies in regards to my meds and my labs. I will tell you this. I have found, with my first pregnancy, depending on your practitioner, like my midwife was very just uncertain about what it would be like to work with someone without a thyroid. And so I was referred out, and really I essentially was telling that doctor, I was like, okay, this is what I do. This is what I'm looking for. And he was like, yeah, okay, cool. Yeah, let's optimize that. And so he gave me my meds. But I will tell you this is what I had to do. In my first trimester, I had to increase my thyroid meds because of the demands of growing a baby, the shifts with my hormones. And so what I found in regards to blood work, which I don't think it's done enough for women with hormone issues or living without a thyroid, when I had to switch my thyroid meds, I was getting blood work done every 5 to 6 weeks. Until I was optimized. And then when I was good, then I would check the next trimester. And I would, meet with the doctor and see if I needed to optimize my meds to keep up with the demands. Because growing a baby, I say this all the time in a very loving way, babies are parasites, okay? That baby is going to pull nutrients out of you. And that's the other thing I will tell you guys. I supplemented and I prepared myself 90 days before I conceived, and I'll let you guys know what I did with that. In a separate video, I'll break down kind of the supplementation and what I took and why. But I made sure every trimester that my labs were good, and that I was optimized. And if in that trimester I needed to change it, then I would get blood work done every 5 to 6 weeks until I optimized it. Now, postpartum, I always recommend getting blood work done at 6 weeks. The big thing I noticed with postpartum for across the board women in general is that baby, especially during pregnancy and postpartum, it's all about baby. It's all about, is the baby healthy? Is baby good? And yeah, absolutely. But what about mom? What about mom? Is she depleted? Is her iron low? Is her ferritin low? What do her thyroid hormones look like? Oh my gosh. A lot of times I am having to just encourage and pour into the women I work with during this period of time, and especially postpartum. Like I don't know how many times throughout the years, I'm the first one that did blood work on a woman who was just depleted and extra hair loss and exhausted. And they were like, well, this is just postpartum and it's because I had a baby, or it's because it's my fourth baby. When I found out their iron and ferritin is too low, or their thyroid, or they have, if they have a thyroid gland, their thyroid antibodies went up and their thyroid is shutting down, or postpartum, post-thyroidectomy, they need to go see their doctor and optimize their thyroid meds. I do this because I had to learn the hard way. I will tell you guys, the biggest mistake I have made every postpartum period, I want you to understand, my births were great. My first one was more difficult for sure, and each birth got easier and easier. My postpartum was good, except I got caught up in motherhood. I got caught up in life, and I did not prioritize my meds. I did not prioritize optimizing my meds. I did not prioritize my labs. And this is what I recommend post-thyroidectomy: to look at your partner, to look at a family member you trust and say, hey, I need you to get on top of me and make sure that I'm getting my blood work done at 6 weeks, that I'm optimizing my thyroid meds so I don't miss a really important time of optimizing my hormones, because I did. And that is the worst. I will let you guys know this. Each postpartum period, I have to start on completely new types of thyroid meds. I mean, what worked for me during pregnancy, I can up the dose, I can decrease the dose, I can change it up. I have to go into completely new labs. Not new labs. Well, yes, I have to get completely new labs. I have to do completely new meds. And the crazy thing is, even as soon as I switch meds, even if I'm not optimal, I start losing weight, I start having energy, my hair starts growing back. That and there some hair loss is normal with the hormone shifts that happen and breastfeeding and all of that. But that was the one thing I did regret with my first two. Even as a doctor and everything I do, you can just get sucked into the life of a new mom and a new mom of 2 or 3 or whatever, and you can forget about yourself. And I hated that with my first 2 pregnancies, and even this last one, I did not switch things as soon as I should have. And that's the one thing I just would like to tell all of you guys postpartum, especially with nursing, like low thyroid hormones, like 2.3, 2.5 when it comes to free T3, that can decrease, your milk production. Not only that, but your brain health, your mental health, your neurotransmitters, your gut health, everything's going to be affected by that. So I always recommend just that first 6 weeks, and if I have another one, I don't know, we'll see. That's going to be a big thing for me, where I'm going to make sure everyone knows, hey, you need to help me stay on top of this, because if I need to change my thyroid meds, I need to do it immediately, because it feels like a lot. It is a lot to have to change your thyroid meds because you don't know where to start and how to optimize that. But I do hope, if you guys need help with that, I can educate you guys that there's a link in the show notes about what it looks like to do consults with me or to join my membership community. But it just takes post-thyroidectomy. It takes much more education, much more advocating on your behalf in the doctor's office, and a lot more just being aware and being open to the fact. And this is what I tell people post-thyroidectomy is you have to be open to the fact that you might need any and all thyroid meds. I've tried every and all thyroid med, type of thyroid med in combination, and I can find benefits in all of them. But in the end, fertility and pregnancy and postpartum doesn't have to absolutely suck. But you have to be an active participant in optimizing, not just being within levels, not just being on meds, and not just handing your health over. You have to be an active, aware patient in all of this process so that you can have the best hormone health for your overall health, best pregnancy, and best postpartum. Let me know if you guys have any more follow-up questions about this in the comments. I'd love to share as much information to equip you guys and educate and empower you guys to thrive post-thyroidectomy. And make sure to subscribe so that you can get new videos and new episodes straight to you.